I'm Dr. Lauren Gerson, Senior Associate Editor for Gastrointestinal Endoscopy, and it's my pleasure to be interviewing Dr. Jennifer Lai, who is also a fellow at California Pacific Medical Center. We're going to be discussing our article that's going to be appearing in Gastrointestinal Endoscopy entitled Prevalence of Colorectal Cancer in Patients with Breast Cancer, which is a meta-analysis. Now, Jennifer, you and I came up with the idea for this study as we realized that there are many women with breast cancer who are often referred to us for colorectal cancer screening. And the question that often comes up in the community is whether these patients should be screened more often than patients who do not have breast cancer, and at what age the screening should be undertaken. Should it be at an earlier age or when the patients actually present with breast cancer? So we know from reviewing the literature that the prevalence of colorectal cancer in these patients has been around 1%. And so the goal of our study was to try to determine if the prevalence in breast cancer patients was higher than has been reported in the past. Jennifer, can you describe how we did the study?
Sure. So our primary aims of the study was to really look at the prevalence of colorectal cancer in breast cancer survivors. Breast cancer is one of the most common cancers in women, and they actually have a great survival, so we need to really make sure that the recommendations for surveillance of secondary cancers is appropriate. So the primary aim is to look at the colorectal cancer prevalence in these women. Some of the secondary aims was to look at also the prevalence of advanced colonic adenomas in breast cancer survivors, as well as colorectal cancer prevalence in women who are maybe diagnosed at younger age, such as younger than 45 or 50 years of age.
So turning just briefly to the results, we looked at retrospective studies, or around 37, and case control studies, and we found essentially there were over 1 million subjects that we looked at with breast cancer, of which there were about 10,000 cases of colorectal cancer. So our overall prevalence was about 0.7%, which matched up very well with what had been reported before. There was significant heterogeneity between the studies, and we tried to remove this by looking at older studies or studies done in different populations, but essentially that was not reduced with further analysis. Do you want to talk next about the prevalence of adenomas?
Yeah, so we also looked at, we had 8 case control studies included in our meta-analysis. These case control studies also did not show a significant, well, the odds ratio was 1.2%, but this one was not a significantly increased prevalence of colorectal cancer in breast cancer survivors. Similarly, there was about 4 or 6 studies that looked at the prevalence of advanced colonic adenomas in breast cancer survivors, and there was also a non-significant odds ratio of 1.5%.
And so what about the younger patients? These are the difficult ones, the ones that are diagnosed with breast cancer, say at age 50 or 45. What did we recommend and find in that cohort of patients?
Yeah, that was really interesting because some other authors have proposed that maybe women who are diagnosed with breast cancer at a younger age are at a genetic predisposition to also get other secondary cancers, such as colorectal cancer. So we did a sub-analysis just looking at the age of diagnosis of breast cancer and whether that affected colorectal cancer prevalence. So in the studies that looked at specifically at women, or 4 studies that looked at specifically at women who were diagnosed with breast cancer at age younger than 50 years old, there was a statistically significant increase in colorectal cancer prevalence with a pooled odds ratio of 2.5. And that was over 64,000 breast cancer survivors. In the 3 studies that looked at women who were diagnosed with breast cancer younger than age 45, and this is almost 95,000 breast cancer patients, there was also a significant pooled odds ratio of 2.3. So these women altogether who were diagnosed with breast cancer at a young age were found to be more than 2 times likely to get colon cancer than their older counterparts.
So the other question that comes up is in patients who have genetic mutations, like the BRCA mutation, should we be screening those patients differently?
Right, and there were some studies that suggested that maybe carriers of BRCA1 were more likely to get colorectal cancer, but we weren't able to find enough data to regarding BRCA1 or 2 to include in our meta-analysis.
So let's just sum up basically what our conclusions of our study were and the recommendations based on this meta-analysis.
So I think that we were successful in showing that the colorectal cancer prevalence in breast cancer survivors is not different than the general population, and therefore women with a history of breast cancer should just be screened for colorectal cancer at age-appropriate intervals. And additionally, we weren't able to, or we showed that these breast cancer survivors did not have a significantly increased prevalence of advanced colonic adenomas. This, however, may be different in women who are diagnosed with breast cancer at younger age, maybe younger than age 45 or 50, because as we mentioned, our odds ratios of 2.3 and 2.5, these women are more than 2 times more likely to get colorectal cancer. So I think based on this data, it is reasonable to say that in a woman who is diagnosed with breast cancer at younger than age 50 should consider having her initial screening colonoscopy at age 45. But of course, this needs more research and validation.
Well, thank you, Jennifer, and it'll be interesting to see how this data influences our future screening policies for colorectal screening.
Thank you so much, Dr. Gersten.